Thank you for attending this breakout session. This session is filled with powerful information to help improve your health and empower you. Radio Free 102.3 KJLH. We are you.
Hello, everyone. And my name is Cameron Green from Radio Free 102.3 KJLH. And this is my favorite time of year. I absolutely love the KJLH Women's Health Expo. Why? Because we are you. It is an opportunity for us to be able to connect with you, to talk about health, to talk about your goals, and to get you on the right track. We're so grateful for Kaiser Permanente's partnership today with KJLH as an associate sponsor for this 20th Annual Women's Health Expo. Now, Kaiser Permanente has been part of the greater Los Angeles community and the state of California for 75 years. Their mission is to provide high quality, affordable healthcare services and to improve the health of their members and the communities that they serve. So today is going to be a fantastic conversation. We've got two phenomenal professionals, a panel of physicians for this breakout session entitled Trust. That stands for Thinking, Reflecting, Understanding, and Storytelling. The mission here is simply community health, and we know that during this time, community is most important. We're so pleased to have with us today Dr. Darren Sutton, who is an attending emergency medicine physician, born and raised in the NYC, so rep in New York, where he spent the majority of his career training to become a physician, a graduate of NYU. Dr. Sutton joined Kaiser Permanente South Bay Medical Center's emergency department, and we're so glad to have Dr. Darren Sutton. We also are pleased to have Dr. Phyllis Hayes Reams. Reverend Dr. Phyllis Hayes Reams was born and raised in Long Beach, California. I'm an LBC girl, so it's great to see you. She's a graduate of Stanford University with a bachelor's in human biology, attended Charles R. Drew University of Medicine and Science and UCLA. She holds a master's in public health. She joined Kaiser Permanente Southern California group at South Bay in 1997. And just like Dr. Sutton, she is a wealth of knowledge. We're going to hear from the doctors. We're going to dive into some questions, but I'm so pleased to welcome Dr. Darren Sutton and Dr. Phyllis Hayes Reams. Thanks for joining us today. Now, we're going to talk a little bit about some things that I think are really at the cusp of all of our minds right now, given, excuse me, COVID-19, given our experience with our doctors. We know, specifically women of color, the relationship with doctors, once you find one, you latch on to one, right? But that can often change. So we're going to talk about the patient experience. As a person of color, have you ever not felt heard as a patient? How did you navigate that experience? So what say you, Dr. Sutton, as a person of color? Have you ever had, an experience with a doctor that was not favorable? And what are some best practices that we can look out for when selecting a good physician?
I think that's a great question. I have to say that as a person of color, I think that the resounding answer for most of us is yes, we've had uncomfortable interactions with physicians. Reasonably so, because it's a differential of power that occurs within that setting. And that can make people uncomfortable, and it makes me uncomfortable. I think that the number one way that I've experienced it was on a family level. Being a young child and watching my aunts, grandparents, my mom go to the physician and understanding their frustration and realizing where that came from. And not really understanding it, to be honest, until I became a physician. I have to say that some tips that I've grown to become accustomed to is serving as an advocate. Number one, for example, my grandmother, her care, primary care, requires a lot of work, and I never realized it until I started to participate in it. And I think it has made me a better physician, but it has made me realize the inequities that exist in healthcare and how they can play on a systemic level, but also on a personal level. So if I had to give someone a tip, my number one tip is advocacy. Bring a friend, bring a relative, because it's really, really intimidating to be in that situation. And many times being the outside person, you can serve as a resource, but also as kind of a recorder to help record that information and relay it to that person after they leave. Because we all know too well, we nod when a physician says something because we don't want to let them know that we may not understand. That's a natural human behavior. And I think having that advocate there helps solve that issue, but there's still tremendous work to do.
It's fantastic. I heard you say a key word in advocacy, and how important it is to have someone who you feel can have your back, so to speak, accompany you. And the same would be for you, Dr. Hayes Reams. What guidance would you give a patient who doesn't feel like their physician is listening to them? What do you think about some best practices that women can take in choosing a physician that meets their needs?
I agree 100% with what Dr. Sutton said. And additionally, it's important to prepare for your appointment. Make a list of your questions. I think many times patients and families get intimidated as well by the perception of that limited appointment time. They feel like, how am I going to get all of my concerns out? And to be honest, sometimes we as physicians impose that stress, that because we have this feeling of rush, 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 rush. And so I would really recommend to the patients and families that they prepare, make a list of your concerns, prioritize your concerns, know that what are the top 3 things that I need to go away with this appointment. The more prepared you are, the more you can, as Dr. Sutton said, advocate for yourself. I think you will gain the respect of your physician. Additionally, there are times where there's just not a good fit. And we have to give ourselves permission to know we have choices. There's always choices. Yes, does it mean that you may have to go the extra mile to make that choice happen? But there's choices. When it comes to your healthcare, you want to have a relationship with someone that you can trust, that you can share your most intimate details, because it could be a matter of life and death.
That's very true. And I think building upon that, as this panel is called Trust, and thinking about how we are sort of navigating those relationships and creating those relationships, as people of color, I think specifically, trust has always been a difficult subject for us, not feeling heard, not feeling like our needs are met. And Dr. Hayes Reams, you hit on something in saying sometimes we feel like the physician has rushed us in the door and out the door, so to speak. So speaking from a lens of people of color, like really thinking about who we are as people of color, how can we build trust, especially for those who may not have seen a physician in a while?
I think what Dr. Hayes Reams made a statement is taking notes and making sure that you are able to ask a question informatively. I think that the best thing to do is to ask simple questions and judge the answer. You are the judge of that answer. And if you understand it, you can create a better understanding of the level of education that physician is on. As physicians, we're taught medicine, but we're not taught communication. So I think that many times the issue is at the level of communication. And if you feel like it's just not there, then as Dr. Hayes Reams said, you need to make the decision and probably get a second choice. Never feel forced into an option or a choice, because as a physician, our job is to educate and give you the options and the choices. And as a team, we're supposed to work together. So if that relationship doesn't feel like a team relationship, then you definitely need to put yourself in the position of onus and take charge and separate yourself or find another option.
Mm-hmm. That's great. That's great. Thank you. Dr. Hayes Reams, the same question specifically too about being a woman of color. What is important for that relationship building with your patients, and what should patients be thinking about?
I think for me, over the years, is I think the most successful patient-physician relationships that I've seen is where there is a sense where the physician feels most comfortable within their own skin to share a part of themselves, to be sensitive. In terms of when I train medical students and residents over the years, I told them, be present where you are. You actually can bring more quality and positive outcomes to your appointment by just breathing, take a deep breath, and be present with the patient. Because patients, just like we ourselves when we are patients, can sense when someone, as Dr. Sutton and I were saying, are rushed, or they're not listening to us. And so listening doesn't take a long time. It doesn't take 30 minutes. But when you make that connection, just be present in the moment. And I think that as patients as well, we have to go in and want this care because we value the importance of it.
Yeah.
If we go in saying, well, I want to hear what I want to hear, and so as long as that doctor is glossing over and it sounds like what I want to hear, I'm fine, you're going to be the one that suffers. Yeah. Arm yourself, research, talk to others on what type of preventive health you should be seeking. Know your family history. Know what you should be expecting from that medical encounter. And if that physician is, as I said, glossing over it or not really taking time to address those very important preventive measures, then you really owe it to yourself. You owe it to your family to get with a physician who's going to really be, as Dr. Sutton said, your advocate.
I love this. I mean, we have two of the finest doctors before us here. What I appreciate about what you guys are saying is that I really hear the passion. I do really hear the care resonating in your voice. And it's just so important for the women that are watching this, this recording or watching this panel to be able to understand that there are doctors that actually care, right? And so we shouldn't be afraid. We should be proactive. Building relationships, it's like anything in life, right? It's like dating. If you don't know someone, you have to spend time with them, right? To create a relationship. And I would think that would be the same for, your doctor, spending time and creating and building a relationship. And in this time, this is just, I think, a time that we've never seen before. There's so much going on at a rapid pace. I can imagine that you all are seeing more links between stress, systemic racism as people of color, and health outcomes. The research and the data certainly showing that. Are you seeing an increase in patient stress given the current social climate, Dr. Sutton?
Absolutely. I think that there's an underlying level of anxiety that is pervasive throughout the community. And oftentimes, I think as a protective mechanism, we ignore it and we shut it down and we pretend it's okay. But what I'm trying to explain to my family, my friends, and even my patients is that this is not a normal time. We're dealing with an extraordinary time, and you have to allow that to be present and also allow that to be labeled so that you can attack it. I think that we're seeing it in older communities for fear sheerly of dying, and younger communities for fear of disruption of their normal lives, and even in my young patients who may not be able to display the same symptoms of anxiety and depression and are acting out in different ways. We're seeing it on every level. So I think the first step is to be cognizant of the extraordinary time that we're in and label what the feeling is.
I think Dr. Sutton is spot on. I think that, just as he said, it's amazing. I mean, when the pandemic hit, I think I was in a fog for about 1 to 2 weeks myself, trying to figure out is this a nightmare that I'm going to wake up from, a bad dream? And then realizing that, no, it truly is here, and trying to regalvanize, re-energize, and figure out what the next steps are. And just as he mentioned, the stress, the anxiety, the depression of being disconnected. I have patients in skilled nursing facilities. And I know, as well as Dr. Sutton, we have patients in the hospital where their family members are not able to see them. Families aren't able to visit their loved ones in boarding cares and assisted living. We are, it's just a very stressful time. And as we were saying, is that you have people that behavior may be coming out in being withdrawn. It may be coming out in anger. And so we really are having to push ourselves to be more compassionate, to stop and not just react to how people's emotions are rising. I work in home care, so we have families and patients understandably concerned about us coming into their home to provide care. And it's very interesting, some of the requirements they have for us to come into their home. And it's just a very scary time. I mean, we as healthcare providers, we truly walk by faith when we go out, because you just don't know. But we are committed to do our work and committed to help people. So I know that it has definitely stoked my fire of faith in God to be of service and just put it all in his hands and do what we can do to help others.
I love that. We're going to talk a little bit about the upcoming flu season, because in the midst of COVID, there are other things that are still, I think that we're trying to articulate also, that yes, there's COVID and it's huge, but there's also other things that we need to be vigilant, and mindful of, such as flu season. But because we're on the COVID topic, I do want to spend just a few minutes on this. And Dr. Sutton, I know, we're approaching the flu season, but again, COVID is just, we're seeing, just numbers that are beyond our belief. And you all, both of you on the front lines, I do want to thank you as first responders as well for your service, and recognize really everything that you're doing mentally to prepare, physically to prepare. But Dr. Sutton, you're coming from the front lines of New York, which is the initial hot zone, right, for COVID, when this pandemic first began back in what we're saying March, but we're hearing that it was sooner. What have you observed, about this time coming from New York, and what do you think we need to do ahead of time to get prepared, to prepare ourselves for COVID, to think about the flu season? What are some precautions, knowing what you've seen in your state and coming to California, who I think we're just now beginning to get, move towards the end of the first phase, or not even in that second phase? What have you seen, and what should we do to prepare ourselves for what you already know?
So thank you so much. Coming from New York, where it was a place initially where I think we were shy to say. And the reason why was because you were from the capital the state with the highest numbers. And so in many ways, walking into a supermarket and saying you're from New York is not a cool thing. But now it's fascinating because New York is one of those states that's so densely populated, but has decreasing and stable numbers. I think much of which is from the actions of its citizens who are participating in making sure to keep each other healthy by wearing a mask and socially distancing and offering testing. And I think much of that is done in California, but as people know, California is very different from New York in its diversity of populations, its geographic locations, and just in general opinions I'm feeling. So I think that that's a fascinating point that we can go on in a whole different panel for in terms of discussions. But in terms of recommendations that I could give as someone who, in my mind, has gone through the first level of a pandemic in New York, and now I feel like I'm that person in Twister just chasing storms, and I'm in California, it's the first understanding. It would be remiss upon me if I didn't say everyone should be wearing a mask, everyone should be socially distancing, and everyone should be mindful of the health of others. And I think that is what we have to take care of, is that this is a participation sport in terms of fighting this pandemic, and we must all be actionable and be mindful, because you just don't know what someone else is up against. Many a times I had seen a person who had walked into a Starbucks that was empty except for the employee that was serving them. And the employee asked politely, would that person wear a mask? And the person responded, why? No one is in here. And that scene just helps you understand how some people may view the value of others. Yeah. And we have to be cognizant and do the work. And I think that there is no loss to the fact that many doctors of color find it so easy to explain the basic value of human life in terms of wearing a mask, because we've been doing it since the beginning of time. And so I have many different ideas, and I get very passionate about this topic.
I love that you're passionate about it.
But I want to make sure that everyone knows that we can all do our part. As far as how to prepare, we're not anywhere near the end of this phase of the pandemic. We're very much still in the phase 1 of this pandemic. Unfortunately, due to the actions that have been done in terms of planning, we're just not there yet. We are not a perfect nation. We are diverse, and it's very difficult to get opinions to be in sync. So I'm hoping that in the future, we have a system where people can have clear, concise, informative information, where everyone can simply understand wearing a mask and socially distancing can really honestly help fight this pandemic more than anything. So what I would say to each and every person who's listening is do your part, take care of those around you, and make sure you check in on yourself.
So does that mean you can't go to the barbecue at grandma's house?
Listen,
if she's cooking some rib tips?
If they're anything like my family barbecues, then I would say no. I feel like I've never been to a barbecue where there hasn't been a situation where it's difficult to not come into close contact. Before I left New York, I visited my mom. My twin brother is also a physician, and she had not seen us since the beginning of the pandemic because of reasons of protecting her life, to be quite honest. These numbers were very real, and they hit me on a level that was home. And so for me, exposing my parents to the risk of getting COVID was something I could not do. But I figured out a way to put myself in self-isolation and get tested and be able to see my mother before I came here. And even though I expressed these rules to her, the first thing, if you can imagine, as soon as the door opened, she forgot about COVID and she leaped and grabbed both of us. And I think that is something that I realized in that moment, that no one is perfect and we're all trying. But this lack of social interaction is dawning on us, and it's not helpful for our mental and our physical being. And so I want to tell people, do your best. Do your best. And I'm not asking you to wear your mask in your sleep or to be perfect. But just simply remind yourself every single day you have a chance to do your part and make a difference.
Yeah, I'm glad you said that, because I think that is one of the hardest things. And it seems like the minute you share that, people are just like, you're too militant. It's like, no, just like you said, we have to do our part, right? We have to make sure that we're putting social distance ahead of everything. Wearing a mask is so important to protect not only yourself, but those that you care about. And Dr. Sutton, what are some of the symptoms of COVID? Now, I'm saying this because as we approach the flu season, I know that there are a lot of folks who are not sure whether they have the flu or COVID. So what are the symptoms of COVID, and when should someone seek medical care? And then what is the difference between flu and COVID? What kinds of things should we look for?
This is a great question that does not have a good answer. Number one, in the beginning of March, when we first started to see COVID erupt inside of our states, we defined it as a respiratory illness, defining as shortness of breath, cough, and fever. But what we've learned as physicians and healthcare providers is that it's very much different from that. The symptoms can be a relatively wide range that can include fatigue, chronic muscle aches, abdominal pain, diarrhea, and even loss of smell, as many people have quoted in their experiences with COVID. So what I like to tell people is that if you have any new symptom, act as if you have COVID. Right now, we simply don't have the wherewithal and the resources to test every single person, and that's a sad consequence of the lack of planning that has gone into preventing this virus from continuing to spread. But if you have COVID, or if you have been exposed to someone who is known to have COVID, just act as if you have COVID, self-isolate and get tested. And when you get tested, have the understanding that no test is 100% accurate. And so if it is negative and you have symptoms, still act accordingly. In terms of differentiating between the flu, COVID, and even seasonal allergies, there is no good answer. So as we come into this flu season, I want to encourage people, number one, not only to wear a mask and socially distance, but also prevent the flu. You know, we know that we have the flu vaccine, and it's something that has saved many lives, and many people don't realize it. But just like masks, is a participation effort, and many people have to participate so that we cannot have a compounded surge of a flu season on top of a continuation of COVID season.
Thank you for that. It's so important. And we're gonna pivot in just a few minutes to go back to the flu to really talk about, you know, what that trust and flu vaccination relationship looks like. But Dr. Hayes, Reams, I wanted to ask you, you know, who's considered high risk for COVID-19? And you know, many families, like we talked about, they want to see each other. So if you're going to go see relatives, as Dr. Sutton said, he gave us a few tips. What are some other things you're hearing from your patients and you're advising your patients to do if they want to see relatives? They're just getting tired of staying alone. And then back to, you know, who's at high risk for COVID-19?
Well, you know, I think that, and first I have to say, Dr. Sutton, amen. I agree with everything that you said.
Yeah.
And it needs to be said. We as people of color definitely have to come together and really undergird each other and educate ourselves. We all are at risk to be exposed to COVID-19. We're all at risk to become infected with COVID-19 now. How that manifests itself can vary based on what our coexisting serious medical conditions are. And I think because we're all learning as we go with this. And I think, as you said, in terms of Cameron, our wish to interact, to be together. I think one of the hardest things for myself is my 88-year-old mother lives not far from me. I walk over and I'm speaking to her from the sidewalk. You know, we talk on the phone. But as we said before, we have to continue to be diligent. This won't last forever.
Yeah.
We don't know when the end is going to come, but the consequences are too great to take the chance. You may have a younger patient who gets COVID-19, but is able to, you know, their body, they're resilient enough to get through it. Maybe no big deal. No one knows they have it. But you take that to grandma, to auntie, and get them exposed, an older adult, and they die from it. And I don't think anybody wants to have that on their conscience, that they were the one to infect their older family member. So we have to continue to be persistent. As Dr. Sutton said, it just breaks my heart when I'm out and around, and you know, even in the morning walking, and I see people with no mask.
Yeah.
and they'll just walk right up on you, and it's like, what are you thinking? I'm very concerned about our young adults, our
Thank you.
teenagers.
Mhm.
I see them walking, no mask, they're right next to each other. The recommendations are that if you are following the safe shelter guidelines and you are of the same household, you're probably pretty safe overall to not have to wear masks around each other. But when you are exiting your home and you're going in with other households, it is really recommended that you stay with your household and you wear masks when you're out with other people. And then again, still exercise the social distancing. But I see that not happening. I see them, and not just them, I see people, middle age and that are walking around because we so much
Yeah.
want to feel that we're normal again.
Mhm,
And the
mhm.
reality is there is no normal. We are in a new interim normal, as I call it, until the next interim normal comes. But we have to just hang on. I know that it's hard not being able to go to church and worship together, but we have to be diligent, because if we can hang on, we can make it. If we don't hang on, there's just too many lives at stake. So, as Dr. Sutton mentioned, it's just so important to call each other, face FaceTime, Facebook each other, use Zoom, stand outside on the sidewalk, continue your drive-by parades, um, wave at each other, because that's one of the best ways of showing love, is the ability to resist the temptation to go against the safe shelter and the social
Yeah.
distancing guidelines.
No, I appreciate you saying that. I'm so glad you touched on young people, because I think we're seeing young people, getting infected, and many of them are still, partying or still, socializing. And I get that it's a human connection thing, right? We were built to be around one another, and without human connection, it is very hard, right? But I'm glad you pointed that out. It's so important. I do have one follow-up question for both of you. I know that we're learning new things about COVID-19 daily, how the virus moves. Do you think that when we first started, the pandemic sort of emerged, the officials were advising that it was okay to exercise outside without a face covering? Now we're seeing, I just read a report yesterday about doctors showing that your oxygen levels don't change if you wear a mask. Is there any concern about exercising with masks on? And then also, the importance of, when you walk outside, like you said, Dr. Hayes, Reams, even to your car, should we be wearing a mask? When should we be wearing a mask? When should we not? Is important. So if you could share that. And as people of color, why are we having such a hard time grasping this? Dr. Sutton, let's start with you.
Well, I've written about my experience in different mediums, specifically regarding wearing a mask as a person of color. So I'll get to that in 1 second. But when should we wearing our mask? I've come from a city that is densely populated. You can't get out of the elevator without bumping into at least 4 different people who you don't live with. And so that is a space that you should be wearing a mask the minute you leave your home. Now that I'm getting used to this California life where I can actually breathe without bumping into someone, I'm realizing why the opinions might be different about wearing a mask. But what I have to say is that if you are going to go in a situation where you are closer than 6 feet next to someone in any circumstance, even in the slightest, you should be wearing a mask. And as Dr. Hayes Reams stated, it is an act of kindness. It is an act of caring. You're simply showing to someone else that you care about their health, and that, God forbid, in the event that you might be infected with COVID-19, because as we know, up to 40 to 50% of people don't have any symptoms and are actively infected with COVID-19, you don't want to transmit it. So the simple advice that I would give to everyone is perfect practice makes perfect. And so by that, wearing a mask, making it a normalized experience for you, your children, your family, is something that you can do to better help and fight this pandemic. As far as the second part of this answer, I do understand, as a person of color, a man of color, wearing a mask in many ways can be misconstrued and misrepresented and lead to our harm, to be quite honest. In this age, we can't forget about the current dynamics that are currently happening in terms of the racial awareness that is coming, and also the general awareness that racism exists by many of our counterparts, although it has existed long before we have all existed. I think that it would be lost on me if I didn't state that. And I'll be honest, I've written about this. At nighttime, I oftentimes don't wear a mask in certain situations simply because of the fact that I am a man of color. And I can't not tell that story because it's something that's really important. I think many people relate to. So whenever I'm stating wearing a mask, if you can, that's the only time I give a caveat. And I think it's because of my personal experience. Wearing a mask in the middle of New York City after a late night shift, it's something that's simply another danger to me other than COVID-19. And that has to be acknowledged.
I appreciate you bringing that up. And that's so true. And I think that is something as people of color, specifically our Black men, we have to be vigilant. And I think it's important for us as women to hear that because so many of us are, have sons, have cousins, have uncles and brothers and fathers for that matter that we need to be mindful of and protect. And so I thank you for raising that awareness. Dr. Hayes Reams, the same question. And also too, when you live in a unit and you share a hallway, should you be concerned about walking down the hallway with no mask? If this is airborne, like we're being told, how should we be navigating, similar to what Dr. Sutton said, in tight spaces?
Well, Dr. Sutton is totally correct. I mean, I think that we have to, it's almost in a way like offensive driving, where you have to look out for yourself. When you're walking down the street, have your mask. Sometimes it's better for you to take the higher road and move to the side and let that person move on. You have some people who they'll just barrel on through. Yeah. You don't want to be close to them. You don't. And same way as you mentioned, being in a hallway, if there's a way for you to time it, excuse me, if there's a way for you to time it so that when there's not a lot of traffic coming down your hallway, I recommend it. Or if you hear someone, just wait. The latest recommendations is limits the number of people who should be in the elevator, as Dr. Sutton was mentioning at one time. Don't push it. I think that things are so important now. Wait for the next elevator. It's about your safety. It's about the safety of others. I try my best to remember to wear a mask at all times. I have them stationed different places, but I'm going to admit sometimes if I'm rushing, I'll forget. So I try now to kind of build it into my regular routine. Get dressed, get the mask.
Get the mask.
So it may be hanging around my neck. Sometimes I have to laugh at myself because there's the cover your cough mask, and then there's the isolation mask that we use when we're seeing patients that we don't, that aren't COVID positive to our knowledge. Yeah. And so you may see me with one around the neck here, my cover the cough mask here, and then I've got the isolation. So, but I've had to get over it and not worry about my appearance. The most important thing is to be safe and have your mask, make it fun. If you need to have it fun, get your decorative mask, whatever it is that you have to do, have your bandana, whatever it is, have it, because you just don't know when somebody unexpected is going to pop up. Right. And you're caught in that situation. So it's just better to get it in habit, as Dr. Sutton said, get it in your habit so that it's just a normal part of your everyday prep, is having your mask.
I feel like I have my Lysol in a holster. When I come out my door, I'm spraying the air. And I'm moving kind of stealth because this is really an interesting time. But you're right. Both of you are absolutely right. Using caution and caring for others. And really, like I tell my family, this is not about you. It's time to be selfless, not selfish, because that could really save a life. Thank you so much for that. I want to talk about flu, right? So we know flu season is among us. Flu is not something that we're a stranger to, but flu is actually a very leading cause of death in many communities. And it's very serious. So while we have COVID, we've also got flu, but we've got a vaccine for flu. So Dr. Sutton, can you talk a little bit about trust in the flu vaccine? Can you explain how the flu vaccine works?
So there's tremendous distrust in the flu vaccine. Even as a person of science, I have to battle my own family in discussions about the benefits of the flu vaccine. And while it's not 100% effective, as no vaccine is, it is effective when a lot of people participate, because in many ways it can participate in this idea of herd immunity to allow more people to be immune to a virus in order to stop its transmission. The way this vaccine works, as all and most vaccines work, is it stimulates your immune system to create antibodies that can be protective against the flu. But the flu virus, as we know, is something that changes from year to year based off of just random sequence changes, or random genetic changes that happen as the flu replicates. That's something that naturally happens with most, if not all, viruses. And so we're not always 100% accurate when we make the flu vaccine, because a lot of it is based off of predictions. But it has been effective in limiting the spread of the virus. And in terms of numbers, the flu virus has killed, quantified about 20 to 60,000, and that's an estimate because we just simply don't know, because we don't look at the flu as hard as we do other viruses, because we've managed to control it. Whereas COVID-19, as you stated earlier, has killed over 130,000 people. And that's with active efforts, including social distancing, shutdowns, quarantines. So whenever I compare those numbers, I say that second number, that 130,000 people, that's with us trying our best to limit this virus. You can only imagine what it would look like if we did nothing. And that shows that the COVID-19 virus is significantly more deadly, more transmissible, and more of a problem. But we can help fight it by the things we've stated, but also in stopping the spread of the flu, because it's going to become a problem as we move into the flu season, when we start having these debates of opening schools and realizing that people are putting themselves in harm's way, including our first line, our frontline workers, and our essential workers. We have to figure out options. And I personally believe, and I wouldn't recommend it unless I would give it to my own parents, that the flu vaccine is effective and helpful. And although sometimes people can get symptoms from initially getting the flu vaccine, which is normal, and that is meant to happen, because as your immune system kicks up, other cytokines and inflammatory things kick up in your body and cause you to feel symptoms. But usually it is not the flu. So the risk of the flu vaccine are extremely low, so much so that I'd recommend it to my own family. So if I can do anything, I'd encourage you to get the flu vaccine, because this is not a time where we need to deal with both of these viruses.
Yeah, that's true. Dr. Hayes, Reams, I'd love for you to weigh in on that. Thank you, Dr. Sutton. You know, specifically from the lens of someone who is knowledgeable about our elderly population, who we respect and honor, right? Our elders, and we're largely concerned about them. What do you say about the flu vaccination, and how is it important? How important is it for our elders to think about getting, vaccinated?
I appreciate what you said, Dr. Sutton, so much, because that often is some of the barrier, of people getting the vaccination. They say, I got sick, or so-and-so got sick from the vaccination, so I don't want that. And from our lens, as physicians, when we see the number of older adults that have died because of complications of the flu, we in healthcare are literally fearful about what could be coming upon us with not only COVID-19, but also as we plan ahead to the flu season. Both of them can be life-threatening. So you imagine if you put them both together, we have to do everything we can. Similar to COVID, you may have younger people who get the flu and are able to bounce back, but in my world, caring for older adults is just devastating. As I stated, they can quickly deteriorate and die from complications of the flu. And people that are immunocompromised, people who have chronic medical illnesses, it's just imperative that we do what we can to get our flu vaccination. And my family will tell you that as soon as the flu vaccine is available, everybody's getting the flu vaccine. And they know that's a part of their yearly routine. And I will share this with you, as I know my mother, who I mentioned earlier at 88, she had a year she had been traveling back and forth to visit in Texas, and because of that had missed getting her flu shot. And that was one of the years she was the sickest. And it was very quite scary, to be honest. Praise God, she rallied back, but that made her even more determined. As soon as that flu vaccine was available, she was getting it. And so I just, as Dr. Sutton said, I just can't say enough about, please don't get confused or misperceive the symptoms that people report, or maybe you've experienced yourself around the flu vaccine. Please get it. Again, it could be a matter of life and death. It could be a matter of putting someone else that you love at risk to die from flu.
Dr. Hayes, Reams, appreciate that. What about this healthy population that we tend to talk about between the years of 18 and 40, those who may be living with an elderly grandparent, elderly aunt or uncle, who are not keeping up on their vaccinations, not, seeing a regular physician? Why is it important that this young, healthy population that are living with the elderly be on top of what they need to be on top of health-wise?
I think that's so important, Cameron. I think similar to what we talked about with COVID-19, most younger adults, unless they have a chronic illness or have a weakness or a suppression of their immune system, can pretty much bounce back from conditions such as the flu or COVID-19. And they can almost be asymptomatic. They could have it, but not, have symptoms like Dr. Sutton earlier mentioned. They might think they just have their allergies, sinus allergies, nasal inflammation or rhinitis, as we talk about, but it's actually the flu. But when you are in close proximity to your grandmother, your parents, your aunts, for them, it becomes the doorway to serious illness and complications. People who have asthma, people who have emphysema, chronic bronchitis, people who have heart disease, people who have kidney disease, people who have diabetes, all of these conditions make one at risk to have serious complications from these infections. And unfortunately, for many of us of color, many of our family members have these disease conditions. So with that in mind, our younger population, our younger folks, you are very important in keeping us healthy. So we need you to do your part to help us. We need you to do your part to help your older family members stay on top of what they need to do to remain healthy as well.
Thank you for that. Dr. Sutton, what are some key actions that we can tell our young people to encourage them to want to take precautionary measures, to want to be mindful of the folks that they're living with or in their circle, right? What are some things that we can help encourage them with? What are some things you're thinking of?
I think the first thing is to get educated, understand where we are in terms of fighting this virus, what exactly we're fighting, and be a voice within your community. I'm seeing a lot of younger people share the photos that they share on social media wearing a mask and sharing information specifically regarding this virus and the toll it takes on our older generations. We found that this not only disproportionately affects people of color, but specifically people who live in multi-generational homes. And that is how I grew up, and that's a normalized thing that happens for many people of color. So it's even more imperative to normalize the actions of wearing a mask, social distancing, getting tested, and making sure that you are that person in your friend group. If you have a lot of people who don't believe in science, that brings the science to them. I think that that's one of the best ways that you can help participate in fighting this pandemic.
I appreciate that. I wanted to also ask just a different question, is that, what are some things that you're telling your patients to do to keep themselves healthy during this time? I particularly am someone who I really believe and love, holistic medicine. I'm the black seed oil, vitamin C, garlic kind of person, CQ10, those kind of things. But I know that everyone can't take that. So maybe there are foods, right? If you take other medicines for other things, what are some foods that can keep us healthy? What are some things we should be stocking up in addition to, those maybe some herbs and different kinds of things? What are some foods that you recommend or that you're sharing with your patients, especially during this COVID and flu season time?
I wish that there was a magic bullet. I wish I could tell people to just put some garlic inside of their tea and that this would solve everything. And we've definitely seen a multitude of different ideas of how to solve this virus, and one of which included even drinking alcohol.
Oh my
None
gosh.
of these things.
Don't do that. Don't do that.
None of these things have proven effective to treat the COVID-19 or cure it. So I want to make sure everyone knows that. But what I encourage my patients to do is that this is the best time to get in check with your health. You don't want to deal with other issues in your health that you've put on hold because you simply didn't have time. This is the time to manage your blood pressure, to manage your diabetes, and to take control of things that you can right now. But also in terms of diet, making sure that you keep your diet colorful, making sure that you treat your body like the beautiful vessel that it is, and treating food like the fuel that it is, and doing things that help you. And so there's no magic bullet, but keeping a colorful diet, getting exercise in the best way you know how. That can include a walk or run or just sitting in place and moving around, and making sure that you take control of your chronic conditions and following up and managing those issues.
I appreciate that. Dr. Hayes, Reams, the same question, and specifically for the ladies who maybe from our elderly populations, who, I know my grandmother, she swore by collard greens and she swore by Texas mustard greens, and you know, that was her thing. So we tend to see our elderly population really strong in that way. But what would you tell them, or what are you telling them to be able to stock up on by way of diet and eat more of during this season to prepare their bodies?
I think you're right on track. I think for many of us, we've been at risk to gain weight, and I'm gonna be honest, I'm one too. As we've shifted a lot of our work initially more remotely, a lot of sitting, a lot of meetings via Zoom and other video platforms. It's easy. Stress eating, it's easy. Our older adults who are definitely trying their very best to be at home, foods, you know, the processed foods can become a knee-jerk reaction. So I think that it's so important, as you both have mentioned, that this is our time. We don't know why, but God has allowed this time to happen. And so it definitely gives us a time to look within and see what things that we need to do differently. I know I myself had to get myself together and make a personal commitment as well to look at my diet, make changes, and use some of that extra time to do some cooking again. Keep it simple, but you know, getting those fresh vegetables. I know it may be difficult, but this is a time that being in a group could help. Not being next to each other, but if someone is cooking some good foods, package them. Everything is meal prep. Put them in a package. You can deliver those meals to an older adult. Those type of things are very helpful, especially you know that maybe they can't get to the grocery store. That can be the best sign of love is meal prep, fresh vegetables. Try to decrease the salt, because again, those packaged foods have a lot of salt. I think that's the best ideas I have. And I said I've had to start exercising myself. It's just getting the fresh fruits and vegetables. As Dr. Sutton said, even though you may be limited on your ability to get out and move around within the community, there are so many things available. And again, this is something our young people could do to help us, is leverage those, the apps and the different type of programs that you can help your older family members navigate. If they're chair exercises, if there's walking around the home so that they're keeping their mobility going. These are the times that we actually can still help each other. How it looks may be different, but let's leverage everything we have.
I appreciate you saying that. And that is something also I was thinking about as well. Young people, when you're out, creating your grocery list, and call an elderly aunt or uncle who can't get out, or you shouldn't be getting out, and pick up a few items for them, while you're grocery shopping. And you both hit on such great points of mobility. And while we're stocking up on the essentials, making sure we're stocking up on the essentials of compassion, of empathy, and of kindness, because those are the things that get us through. I'm so grateful for everything you guys both offered. And this conversation today, it was so insightful. I feel like I've learned so much. I do want to ask you though, if you all would like to provide 2 to 3 just takeaways that you think are important based on this conversation, that you want folks to really hear, that you want the women to hear about trust and the flu vaccine and COVID-19 in this moment. What are some key takeaways that we should be considering? Let's start with Dr. Sutton.
Again, wear a mask. I'm going to get a tattoo. That's going to be my first tattoo that I'm going to get in my life. Wear a mask. The second thing is check in with yourself. This is an extraordinary time. And it is okay to not be okay. And then the third thing is check in on those around you and make sure that you can figure out how to do your part.
Dr. Hayes Reams, thank you, Dr. Sutton.
I would piggyback on self-compassion and recognizing that we are living in some very unprecedented times, but especially as people of color, we have gotten through so much. So if we do what we need to do, if we take care of each other in the right way, we will get through this as well. I think for my sisters of color, it is very important that you take care of yourselves. As usual, you have a lot on your shoulders. Take time, take a moment to breathe, take a moment to meditate. Make sure that you take care of yourself. And as commonly is said, is that before you try to put on the oxygen of others, put the oxygen on yourself first. And if we continue to work together, we will get through this.
I appreciate
I'm sure
that.
of it.
Yeah, this has been such a great conversation, and Kaiser Permanente for lifting this trust conversation up as we think about, the ways in which we can continue to lead strong, healthy lives, that we can continue to care for others, that we can continue to check on ourselves. Both of you have just offered some really amazing things. And like I said before, my gratitude to both of you. I don't think our first responders get enough love, get enough support. I feel like a lot of people are saying what you should and shouldn't do, but you're not stopping to think that you're real humans on the other side who have devoted your lives to really taking care of others. And oftentimes your families take a back seat because you have to put yourself on the front line. So thank you so much. It's, again, been an insightful conversation. I've learned a lot. I'm over here taking copious notes that I'm going to definitely review later. So yeah, thanks for this conversation. Oh my goodness, that was such insightful information. What a great conversation. We're going to continue that right now with some fantastic physicians. I'm just so excited by these doctors that are coming up to talk to us. We're going to be joined by two physicians from the Kaiser Permanente West Los Angeles and Baldwin Hills Crenshaw Medical Center. We've got Dr. Madeline Wilkes-Grundy and Dr. Latonya Hines. I am going to read their bio in just a second, but we do want to thank you both for joining us again. We're truly grateful to Kaiser Permanente for their partnership. Of course, this being a partnership with KJLH as an associate sponsor of the 20th Annual Women's Health Expo. This breakout session that we are continuing is entitled Trust, which is really powerful. Trust is the acronym for thinking, reflecting, understanding, and storytelling. The mission basically is community health, bringing folks together. And all the ladies watching us today are really thinking about their own health, thinking about community, and we're going to be expanding on some of those stories and, of course, your great expertise. As family medicine physicians, as OBGYNs, as physicians and champions for equity, inclusion, and diversity. So I'm really, really excited to have you both. Dr. Latonya Hines is a board-certified obstetrician gynecologist currently practicing at Kaiser Permanente's West Los Angeles Medical Center. She joined the Southern California Permanente Medical Group in 2012 and became a partner in 2015. And prior to the role, Dr. Hines was the CEO and owner of Girlfriends Medical Group, a private practice medical firm in Pasadena, catering to the needs of women throughout Southern California. So welcome, Dr. Hines. And Dr. Madeline Grundy is a family medicine physician and clinical instructor for the Kaiser Permanente Bernard J. Tyson School of Medicine. Of course, Dr. Grundy graduated in 1988 from UC Irvine with a bachelor's in science degree in biology, and also earned her medical degree in 1992 from the University of Southern California School of Medicine, and completed her postgraduate residency training in family medicine at Kaiser Permanente Los Angeles Medical Center. So welcome, Dr. Wilkes-Grundy. We're so happy to have you both.
Thank you.
Let's talk about the patient experience. I mean, as people of color, we often feel like we don't get heard. We often feel like we're rushed in the door and rushed out the door. So Dr. Hines, tell me a little bit about your patient experience, right? You're a doctor first, but also a patient in some capacity. Have you ever had a negative experience or an experience where you felt like you weren't heard as a patient? And if so, how did you navigate that?
I could go back to just when I had my children, and being an OBGYN, you would think that I'd probably be the most the most logical person to know the most about obstetrics and gynecology and perhaps self-diagnosing and doing the right thing. Wrong. I had my first child when I was probably older than a lot of people. I was 30, and I was a first-year OBGYN resident, and I had a headache, blurred vision, right-sided abdominal pain, and a history of elevated blood pressure in the pregnancy. But I thought that I just had a migraine and I had eaten something that had stopped bothering my stomach and that I was just stressed. Now, for those who know, those are classic signs and symptoms of preeclampsia.
Wow.
I called because I happened to be off duty, and I called my doctor, and she said, no, you probably are doing okay. Let me know if things get worse. Now, I know. I didn't think that I should have asked more detailed questions, and I was a pretty bright resident. I didn't know what it really felt like to have some of the symptoms that I was diagnosing on a daily basis. It wasn't until I talked to my colleague, because I just didn't feel better, and she said to me, Latonya, if a patient in triage said to you, I have a headache, blurred vision, right-sided abdominal pain, I've had some elevations with my blood pressure, I just don't feel good today, what would you say? And immediately I said, oh, that's preeclampsia, absolutely. And she said to me, so what do you have? And I was like, oh my God, how clueless was I? But my doctor, who said to me, oh, it seems like it's okay. That's not very positive experience, right? So I came to the doctor. Yes, I had preeclampsia. It was a bit early, so they had to do what they needed to do in order to make sure that I could hopefully last a little bit longer in the pregnancy. And I didn't necessarily blame my doctor. I just felt like perhaps she wasn't hearing me. Now, this is my same physician, and I love her to death, that took care of me for the second baby. But in a nutshell, to get to the end of this question, that second pregnancy, she wasn't playing. I was started on blood pressure medication while I was denying and declining. She had me in NST testing early because she was not having it. That baby ended up being 2 pounds bigger and 2 days late.
Wow.
That's my daughter. So that experience, both for me as an OBGYN resident and for a long-standing obstetrician gynecologist who I believed had my best well-being in mind, we learned a lot. I've taken that experience with me my entire career. This is my 19th year of practice. My son is 22, my daughter is 20. I never forget that when I'm taking care of patients. Don't mitigate what their symptoms are, hear them clearly, and even if you think there's something else going on, when you're looking at our demographic, the likelihood of the higher incidence of complications is much higher, so a higher level of surveillance is more important. So that is one experience of many I've had in my life, but I think one of the most impactful that had I not listened, that would have been a problem.
Wow, that's powerful. Thank you for sharing that. Dr. Wilkes-Grundy, how about you? What about your experience as a patient on the other side with physicians?
Yeah, no, it's always difficult. You know, I don't like going to the doctor any more than the next person. So to think that as a doctor, I love this experience and don't mind it, and it's not a big deal. I think there's always some apprehension when you do go in. And I remember I've been playing with my kids and kind of twisted my ankle, and you know, the idea is I'm gonna be okay. I'm gonna ice it. I know what to do. I'm just gonna hang in here and I'll be fine. And the swelling kept getting bigger and bigger and bigger, and it was getting harder and harder to walk. And so then I said, well, maybe I'll come in. And I understand when our members are trying to handle it at home, do their very best, and say, you know what, I'm not going to come in, whether it be the copay, you know, it's not convenient right now. But I finally went in, you know, to the urgent care area. Of course, it was on a weekend because these things always happen on a weekend. And I saw a physician there, and I went in for an x-ray, and all of this like kind of sounded very familiar to me. And I didn't see him again. And the nurse came in and gave me a brace. And I was said, well, what did the x-ray show? What am I supposed to do? How long am I supposed to wear this? What are the instructions? And, you know, do they just assume that, oh, I know what to do? But it really wasn't clear what my next steps were, and the doctor had disappeared. So I asked, well, can I talk to the doctor again? I had some questions. Oh, he's moved on to another patient. So we often will see, we all know we're very busy, but I think that was really helpful with each and every encounter that people understand what the treatment plan is, and they have agreement and buy-in with that treatment plan. To send, our nurses are great, our physician extenders are great, but to make sure that as physicians that we're providing the information for the member. We started, we need to finish. So just not knowing, and I didn't know, not knowing what to do next. How, is it 2 weeks? Is it 3 weeks? How long am I supposed to have this on? So really making sure that we provide the direction that people will need and discuss why we're doing this. Is this going to work with your lifestyle, and are there alternatives? So we have to be really careful with making sure that we start, we go through the process, and then there's clarity at the end. These are the things that we've agreed upon that's going to happen. This is what I want you to do, and this is why.
I appreciate that. And it sounds like you both just really do value your patient's perspective and the relationship, right? And building that trust. Are there certain things as women of color that we should be looking for when we are selecting a physician? Also things we should be listening for when we're in the room, getting into the room? Is there anything that sticks out for you that you see as a best practice for yourself that you think is important for us to know? Let's start with Dr. Hines.
I would bring up, I'm just going to get right to the point. That's one thing I'm known for, is just say it. Not to be offensive, but just get to the point. Number one, if someone tells you that they treat all their patients the same way because they believe in treating people equally, run out the door. And the reason I say that is because either as an African-American woman, as a brown person in this society, the likelihood that your health care, health experience, health literacy is different than the majority population is much more likely. Make assumptions that I know more about myself or about the history. Don't. I want you to treat me the way you would treat any other patient, evidence-based medicine, diagnosis, plan of management, get my buy-in, get my plan. But I want you to see me and see that I do look perhaps different than the general population, and that the likelihood of severity with any illness, the likelihood that you're going to have to follow up and make sure that I'm compliant, the likelihood that all the resources available to me should be presented is what I expect you to do. So yes, treat me equally, but I need you to recognize that a higher level of surveillance, the likelihood that I'm going to need a little bit more intention, and that you need to listen to me is very important. That just because I say I won't do something does not mean that I really won't do it. If I believe you and trust you, it's possible and likely that I will. And understand the history as a Black person or as a brown person in this country. We have every reason to believe that healthcare and its established way of management is biased against us. And that just because I got a brown face, but I'm part of the system too. So we've got to create that relationship, and you've got to trust me and know that I have your best interests at heart. That's the difference. So if you get the feeling that the doctor that you're talking to, whether they are skin folk, but maybe not kin folk, then you need to say, this is not working for me, and be okay with leaving. Be okay with getting another doctor. Be okay with getting a second opinion, and if necessary, a third opinion, because that's what it's going to take.
I appreciate that. Dr. Wilkes-Grundy, what say you?
Yeah, I think, I agree with all those things that Dr. Hines mentioned. And I think even going a little bit further than equally is equitably. What do I need? I may need something different than the next person. What is it that I need? And you're not going to know that unless you get to know me. So you need to know who I am, my family around me, how I'm seeing whatever health issue, whatever things I'm dealing with right now. So it's really important to understand where the person is. And I think in the beginning, set up that this is a partnership. We have to work together. I can't keep you healthy. You have to work, we work together. And I always tell people a lot of this, you have a lot more control over than I do. What you're eating, your exercise, the choices that you make, those are completely in your control. And we know by the social determinants of health that what happens in my office is 15%. Mm-hmm. So you are totally in control, and you want to make sure that you have a provider that you can communicate with. Some of the things that I've heard over the years is a provider making eye contact with you? Do they touch you? Are they examining you? There's some just really some small things that can give you a hint as to where someone might be. Are they listening to you? Are they able to summarize some of the things that you're saying? Are they able to explain things in a manner that you're understanding? And I think that is one of the things that as providers, we speak a different language. When we're talking to each other, we have to remember that that is the case. It's like me going to see the mechanic. I have no idea what they're saying. We're both speaking English, but I have no clue half the time what they're talking about. So we have to make sure that we're communicating, really communicating in a way that our members, our patients have the information that they need to make the very best decisions for themselves. And it starts and ends with trust. And we know has been over years, historically, a lot of distrust with healthcare. So providers have to work even harder to try to build that trust to provide the best outcomes possible for all of our patients.
I appreciate that so much. And, that made me think about just when you said we often don't speak the same languages. And we know as folks of color, right, we understand each other, right? There's certain things that we know. And in this moment in our nation, we're seeing a lot of things happen, right? We're seeing a lot of things emerge. I want to just stay with the patient experience for a minute and ask you all, just as more research evolves around the links between stress, systemic racism, and health outcomes, are you seeing an increase in patient stress given the current social climate? And that social climate also, I want to add COVID to that, because we are now working in ways that we've never had to work. We're now having to transform our place of living into our virtual offices, which in itself can create stress. So Dr. Hines, are you seeing an increase of stress, even as an OBGYN with your patients, given this social climate?
I think we're at a point now with COVID where the primary diagnosis, instead of supervision of pregnancy and antenatal care, is anxiety. That's the number one. And then after that is pregnancy care. And it's just so difficult for pregnant patients. There is newer research. It's not compiled in a journal yet, but it talks about that patients now, just the issue of being exposed to COVID and the potential for it, where there is immunosuppression in pregnancy. Now that's not, you're still immunocompetent. These are fancy words for your immune system works. But because of pregnancy, if you get sick, you're sicker longer, and it takes you longer, and it might be more severe, but you get over it. Mm-hmm. Well, COVID so far, although we don't have a large number of patients in the database, is showing that if you're pregnant, the likelihood of an admission to ICU and the need for additional oxygen and not just CPAP, not just, you might be on a vent. And the percentage, although it's a low number so far that are confirmed with COVID, wherever they are in the pregnancy, they have a higher incidence with regard to being admitted to the ICU. That scares the bejesus out of patients. And so so I've got patients that will never leave their home. They don't want to come in for their prenatal care. And we all know that if you don't at least come in, I can't at least see some of the problems, right? So I can't check your protein in the urine. I can't check your blood pressures. And so we've now started, I'm very proud to say, that for those patients we think are low risk, that we're starting to give them a scale. They get a Doppler for the baby's heart rate, they get a blood pressure cuff, and they get the urine dipsticks.
Wow.
And now they're not supposed to use the Doppler at the time before the visit, and we're doing video visits so that we can physically show them where we want the Doppler to go, what we want them to do for their blood pressure, so we can coach them. And that has seemed to really significantly reduce the anxiety associated. But is there an associated increase in circulating catecholamines and stress hormones that may have an impact on the growth and development of the baby? And that in and of itself affects an increased risk of preterm delivery and an increased risk of depression postpartum. I would tell you the answer is absolutely yes.
Mm-hmm.
That's 19 years of practice. That's still considered anecdotal. But do I believe that there is enough combined evidence-based medicine to show that that risk is real and that the underlying mechanism for African Americans is racism? Yes. So you add on top of it COVID, which affects disproportionately sicker populations, which in this world is Black and brown people. And there's no question that an African American woman who's trying to do her best to eat well, take good care of herself, ends up in a pregnancy exposed, or at least in an increased environment as an essential worker, likely that she is afraid, with good reason, for the possibility that it might be a problem. So the answer is absolutely yes. We're doing our best, as I just gave that example, as well as our postpartum group and our intrapartum opportunities for behavioral health online, to do what we can. But this is rough, and we don't necessarily see a big change coming up soon, right? So I'm gonna turn that over to my favorite, family practitioner, Dr. Wilkes-Grundy, because I know she can tell you about what's happening.
Absolutely, but it's okay to keep having the babies though, right, Dr. Hines?
Absolutely. Look, I love my brown babies. We need the chocolate, but we got to do it safely. Yes.
Absolutely.
Yeah.
Absolutely. Appreciate that. Dr. Wilkes-Grundy, how about you? Are you seeing increased stress cases due to this social climate?
Yeah, no, definitely, yes, among our members, we've definitely seen a lot of changes. Things happened very, very quickly. We had to change our lifestyles very quickly and sheltering in place. And when we're talking about a population as African Americans, Latinos, who do have higher incidence of hypertension, diabetes, high cholesterol, heart disease, now we're putting this new novel COVID-19 virus in place. We're staying at home. You've added fear to the equation because it's scary, because there's a lot we don't know. So there's a lot of information we don't know. Our patients are being bombarded with information and various sources. News is saying one thing, your local public health person is saying something else. You may be seeing something else on your social medicine feed. So that just creates more confusion. Well, what is this, and what do I actually need to do? And then through the course of this, to see recommendations change. Well, first you said no mask. Now you're saying not mask. Now you're saying maybe I need eye protection as well, because of the nature of this virus. So, we're building the plane and flying the plane at the same time here. And as new information comes through, things are going to change. So now that I'm at home, I may not be exercising as much. There may be a fear of wanting to go outside. I may not be eating as well as I could because you've got that added extra stress. We've seen increased use of alcohol, people at home. So we're seeing people drinking more. Drinking raises your blood pressure, your blood sugar. So when we're doing those labs and checking, to see, how are you doing? We're doing phone visits. Let's go over your numbers. We're seeing some of the spikes in those numbers. And patients are really, they're like, I know it's tough. I know what I need to be doing. I know I need to be walking. I know I can eat better. But they're feeling the stress, and it's translating into the behaviors in terms of how we're dealing, how we're coping with this time of uncertainty, and the fear of COVID being such that we're not getting the care that we may need if we're feeling chest pain, if our arm is starting to tingle and feel weak. So we have a delay potentially in care and diagnosis for some major complications of our underlying chronic illnesses. So, you know, the strokes, and we know for a lot of these things, time is of the essence.
Yes.
We know that we have a certain window of time to get in and improve that blood flow again, whether it be the arteries going up to the brain or the arteries to the heart. So delay is going to cause more problems later on. But, you know, we understand that what this fear has brought to a lot of people in general, where there's things they just don't feel comfortable doing. And the mixed messages that they're getting makes it even that more difficult. You know, do we even know what we're doing? Does anybody know what's going on? You know, so that's an unintended consequence of this, all of this that's going on.
And I would add to it that we haven't brought this up, but the incidence of suicide amongst our colleagues, our physicians.
I appreciate you bringing that up. Can you touch a little bit on that?
I would say that, you know, physicians they're almost superhuman, right, Madeline? They are supposed to, they don't get sick. And you've seen a patient look at you with the side eye if you called in sick, or they don't care. You know what I'm saying? They want their appointment. They need you at your 100%, 110%. And yet we are human beings too. And I think that same level of anxiety, that same level of not knowing, misinformation is subject to the physicians as well. And yet we're supposed to be evidence-based, but you can be as scientific-based as you want to be. And yet illogical behavior is prominent, right? You're like, this doesn't make any sense. Why are you saying this? And we have to be unified as a community of physicians and say, we are going to go with science. And we're not going to go down that rabbit hole of conspiracy theories or things that are not evidence-based, and accept and admit that we don't know. It's hard for a physician to say they don't know. But we have to be open to say, I'm willing to try as best I can to get the answer. And here's what I do know. And this is what I think is best for you and for all of us in this situation. And I think that when we say that, I hope we're building better trust, and that the patients will continue to maintain that relationship. Because I still think that we as physicians have a level of trust that perhaps other industries still don't. So we don't want to erode that. So when we talk about suicide, there are lots of physicians who have contemplated, have a plan, and we're looking like, what? This job's not easy.
Yeah.
And the volume, and you add COVID and the isolation for some physicians, it's tough. So I think that we have to say that. We even had a board question. I brought this up many months ago about when it gets to the board level, we're taking questions on it. I think that's pretty prevalent. And so we've got to recognize that is an issue for us, and that wellness and that reality that we have to take care of ourselves before we can take care of others. And so we have to do it. And if you need a mental health day, you need to just say, not today. That's what has to happen. And we also have to be psychologically safe. Am I not right, Dr. Grundy? That you can say, this right now, I need a day, or I need to take some vacation. And when you come back, you're ready to go, and you're that much better as a provider and as a physician taking care of your patients. So I want to bring that up because we've had some significant issues in our department, but I'm sure in all departments.
I'm so glad you brought that up.
You don't have to be Superwoman or Superman.
Yeah. No, I think on that note, Dr. Hines, I was, as providers, we often will tend to kind of suppress our individual feelings because we know we've got to be able to make sure that we're taking care of our patients, we're coming to work, we're doing all those things that we need to do. And, you know, racism is not new. This is a chronic systemic issue that we've been dealing with for hundreds of years. So this is not new. And if we were to spend all day thinking about it, how would that impact us being able to do our work? If we think about what has happened, when you think about seeing a video of a group of people trying to put a noose on a young man. So that can really make it difficult. So all those things are happening, and we're going, we're doing the best we can. And I was actually on a call, And oftentimes when people ask you, well, how are you doing? What do we say? Fine, we're doing fine. I'm doing just fine. And one of my colleagues started talking about her experience and how she feels being at this place. And, they asked, does anyone else want to share? I go, "Oh, sure." And as soon as I opened my mouth, it was like a volcano came and erupted and tears were rolling down my face. And my first thought is like, oh my gosh, I've got to reel this in. I can't show this side of who I am and why I'm afraid for my 20-year-old Black son who looks like all the rest of George Floyd and who's no different. And we often don't see the impact that it is having on us. Yeah. So I think, but my first thought was like, oh my gosh, I can't do this. Mm-hmm. But I had no control at that point, and it just came out. So it's affecting all of us. We're no different as physicians. We experience these things as well.
People of color first, right?
Black absolutely.
First, Latina first,
absolutely.
Right?
Absolutely.
I think it's really important, and I appreciate both of you sharing that, because as we're talking about trust, right, and building trust, I think it is also just as important for the ladies that are watching this to understand that just like you're expecting that trust from your physician, the pendulum swings the other way. You need to also respect your physician. And what I'm hearing from you is that demand, and that really just you saying it is very important. We're here to help you, but we're also people too. And the weight of the world that you carry when you walk into your offices is very real, right? And to have to be able to be on when you walk into the door to see your patients, I think is something we don't often get to talk about. Excuse me. So I'm so glad that you brought that up. That is so powerful. And I'm glad that we have strong doctors representing that voice and being honest and transparent so that we can hear how we can better serve you as we look to you to help us, right? I do want to pivot the conversation a little bit and talk about trust and flu vaccinations, right? So we've got COVID, but in the middle of COVID, there's other stuff going on, right? There's still other things going on like the flu. So, we want to talk about the flu shot. I know there's a lot of myths around the flu shot. Does it work? What is it? So Dr. Wilkes-Grundy, can you talk about why flu shots are so important? And do we see any health disparities with respect to the flu vaccination in the Black community?
So, you hear a lot of talk now about we're waiting for this COVID vaccine. We got to get it. We're waiting for it. We want it by the end of the year. So we've been doing flu vaccines for a number of years, and there can be some misconceptions about what the vaccine is supposed to do. I've had patients tell me I took the vaccine and I got sick. So I think the first thing is the flu vaccine is not going to keep you from getting sick. So that's, they said I had stomach flu after that flu vaccine, or, I ended up with bronchitis, I had strep throat. The flu vaccine will protect you from complications related to influenza. That's it. And most of the vaccines will have 4 different strains of influenza in them, but they are just designed to help prevent those complications related to flu. I think a couple of things that make it a little uncomfortable for a lot of us is that it is made on a yearly basis. Our measles vaccine, polio vaccine, they don't come up with new vaccines every year. So why is this one different? And because there's different strains of flu, there's different types of flu. So we have to make sure that we are looking, and the scientists are looking at other parts of the world to say, well, what strain of flu is making the people in Australia sick? So that's likely the strain of flu that's going to come to get us here in the United States and California. So they are using that science to see what do we see in other parts of the world. And so we need to make sure that we're putting those strains into our vaccine. And that happens on a yearly basis. So it's different than a lot of the other vaccines. How it's made is going to be very similar. It is not made with the infected part of the flu virus. So it's real important to know that the flu vaccine will not give you the flu. It doesn't have the ingredient in there. The inside part of the virus that causes the illness and sickness is not in the vaccine. So it will not give you the flu. On the other hand, can you get a reaction after the flu vaccine? Absolutely. And I'm very honest with my patients, letting them know that that can happen. You can get a low-grade fever. You can have a sore arm. You can feel achy. You can feel something for a couple of days. It's no different than, I use the analogy when, as a parent, if I have members that are parents, and you take your child to get those vaccines. And often those 2, 4, 6, they're getting 4 or 5 different vaccines. And what happens afterward? They may get a fever. They may be cranky. They may, not feed as well. So there's things that happen as our bodies, our immune systems are trying to make those memory or antibody cells to be able to fight off whatever infection we're vaccinated against at some point in the future. So you can have some symptoms after the vaccine. Another thing we see is people saying, well, I got the flu shot and I got the flu anyway. We need to do a lot of education in terms of what's flu, what's not flu. Did you have a temperature of 102, 103? Did you have a terrible headache, body aches? Did you have a horrible, dry cough with chest pain? And I think now, those, if we look, those are similar to some of the things we see for COVID. So the importance of being vaccinated this year and every year is exponentially going up here, because the treatment is different. We have treatment for flu. We have prevention, which is always number one, especially when we look at the disease prevalence in our communities. We know that those complications are going to be more in our patients with diabetes and hypertension. Asthma, obesity is a risk factor for flu. So when we look at those things, we know that we're dealing with the population who's at a higher risk of both flu and COVID because of the chronic disease burden. And the importance of the vaccination in that group is just, it's dramatically important, because our goal is to keep you out of the hospital. Yeah. Our goal is to keep you off of those ventilators. So the importance of the flu vaccine is, my son he did a trip to Africa, and he was studying abroad. He had to get his vaccine record, and he's looking at it and looking at it. He said, I've had 17 flu shots. I go, absolutely, you've had 17 flu shots. You're not missing school. Absolutely. So I would never suggest something to my patients that I don't do, that my family does not do, because I want to protect them as well. I want my family to be healthy. I want my patients to avoid any unnecessary hospitalizations and infections.
Thank you for that. Dr. Hines, the same thing I'm thinking, or Dr. Wilkes-Grundy was speaking about the vaccine. What about pregnant women? Like, is it safe for them to get the flu vaccination? Have you been talking to your patients? Do patients have questions about that?
It's like pulling teeth in pregnancy, because, let me rephrase that. When you're pregnant, you want to do everything you can to have the safest and healthiest pregnancy. Mm-hmm. It's why you show up for prenatal care. But lately, certainly I'll say over the past decade, I have been informed with the more natural approach, the anti-vax approach, the birthing plan approach, leave me alone approach. Okay, let me add that this, from an evidence-based standpoint, since you show up for prenatal care, let's talk about what happened when we didn't have prenatal care. Less than 100 years ago, almost half of the patients, and I won't say half, let's just say people died in pregnancy often. We didn't know as much back then, but now we know why. People used to accept it in their families, that, oh, she died in pregnancy. Oh, the baby didn't do that well. Here comes 1940s and 1950s. Now you get World War II and you get antibiotics after the war. And from there, you have sterile technique with regard to operating on people in the bush. So we got better about treating people with antibiotics and clean and sterile technique. Then comes along surfactant, which is a product that's used to what we call decrease the coefficient of friction, so that newborn babies with respiratory problems or preterm babies can breathe a little bit better. And along the lines, there have been lots of innovations in pregnancy that have helped to make sure that patients who otherwise, without this information, likely would have had a much poorer outcome or perhaps death. Now, I say that because vaccines, when we talk about medicine, and there are a lot of things we think we can do, but at least one of the things that we've been very successful with is eradicating illnesses with vaccines, viruses.
Yeah.
So when you tell me about measles, mumps, rubella, you tell me about polio, and you tell me about even chicken pox and smallpox, I look at you with the slant eye if you say that somehow vaccines are not important. We really only ask for 2 vaccines in pregnancy. That's Tdap, which is whooping cough, a well-established respiratory illness in the baby. And if you deliver during the winter season, flu season, that baby's at increased risk of exposure. And you can't give the baby the vaccine because of the way that it's set up. That vaccine should not be given to children that early. So the mother passes that immunity on. When you say it like that, mothers go, okay. It's the same principle with the flu, that if you give the vaccine to the mother, she will pass on those antibodies to the baby. And even though it's an immature immune system at the time of delivery, which won't mature for at least 6 months or more, you've at least started your baby off with some protection.
Yeah.
The people around your baby, those first primary caregivers, should be vaccinated so that they're not vectors and bring the respiratory virus to the child. If you think that as a new mom, you're going to be in some isolated environment in a bubble and that you'll never come in contact with anybody, Dr. Grundy knows what I'm talking about, you are sadly mistaken. So everything that you can do in order to protect the baby is a good thing, and yourself. Because if you get ill, how are you going to take good care of the baby? So those are 2 vaccines that we talk about. But the kind of discussion that we're having now over these past few years is how medicine, many patients believe in the community, is the cause of autism. That the vaccines are the cause of autism. And somehow there are people out there who have way more influence than I do. And they're just convincing them that if you just do nothing, that you won't get it. Well, the Black community does not have the luxury of acting like we won't get it, because if there's any group amongst brown and Black folks that'll get it, it's us. So I always point out that, do you think that our majority colleagues or our white colleagues don't believe in science? Do you think that the reason why they get vaccines is because they think they're better than us, they're stronger than us? Do you believe that? And the answers are always, oh no. So why do you think that somehow or another their incidence of these diseases is less than ours? And they'll look at me with that eye, and I'll go, exactly. I want you to put that together. That if you believe that medicine has a plan, if you believe that sitting in front of me, educated in this environment, is helpful, then if I give you a recommendation that I will accept and get a vaccine every year and make sure my family gets, and if I was pregnant, I'd do everything that I told you I would do, trust me on this. And my outcomes, and I'm very proud to say, because I'm sure they're tracking me, I have some of the highest risk patients in my group. You name it, they got it. Diabetes, hypertension, obesity, multiples, twins, 40 years old, name it, all in one person. And yet the outcomes are good. And the ones who do the best are the ones who are willing to just go with me. Some of them don't believe nothing that I say, but they say, if you said it, I'll do it.
That's good.
And when they have a good outcome, they become the best people out there to tell everybody else, I think she was all right. Now that makes my clinic crazy, just like Dr. Wilkes Grundy. But there's something to be said for science. And yes, I believe that not everything that science says and does is right. And they'll bring up the Tuskegee experiment. I'm with you there. It's called the Tuskegee experiment for the lack of treatment for Black men. I'm with you. The fact that that was ongoing to the 1970s and that we were a part of it as Black people, given the doggone placebo, I got you.
Yeah.
Well, I hope we've learned. So that's why I'm saying, go with me, please.
I appreciate that. That's a perfect pivot into our next topic, and that is around COVID-19, right?
Oh yeah.
Because COVID-19 is real, and we know that there are a lot of myths out there in the Black and Latino communities, people of color in general, Native Asian communities, around COVID, what we should be doing, what we shouldn't do. We see the mask fights. I'm not going to wear it. I am going to wear it, right? But it's no secret that Black and Latino populations are really being impacted by COVID-19.
Oh, yeah.
So Dr. Wilkes-Grundy, you know, why do Black and Latino communities seem to bear the brunt of that? And what can we do? What can we do? How can we educate ourselves in our communities around COVID-19?
Yeah, I think, you know, that kind of goes back and definitely ties into kind of what systems are in place. What kind of jobs are a lot of our Black and Brown people, our family, what kind of jobs are they doing? Are they public facing? Are they out there helping us at the grocery stores and helping with delivering things? And do they have the luxury to work from home? So there's a lot of people who do not have the luxury to work from home. California is a prime example. Before we opened things up and when people were at home, when there were no schools, we were able to slow things down a bit. But again, you know, you're kind of balancing. You have to look at, I've got to feed my family.
Yeah.
I have to go to work. So I think there's these systems and structural racism. There's things in place that do not permit us to be able to work from home, still get a salary, still be able to take care of our family, and limit our exposure. So our exposure is a lot higher. Again, those underlying conditions keep coming back to us. Often it's at a younger age. Our Latino brothers and sisters experience diabetes a lot younger than other populations. Our African Americans experience hypertension younger age than a lot of other populations. So when we look at that, when we look at how are we living, are there several generations in a home? We know that there's information about children and things. Again, we're building the plane and flying at the same time. Now they're saying, well, maybe over 10 years old are going to spread it and bringing it back to the family. Under 10 or the very young ones, maybe less likely. But are we able to socially distance? Often we're very social communities. Family's important. Those gatherings are important. And, you know, to touch and hug, all those things are very important. And now you're telling us we can't do that, only with the people who live in our home. So it's really, really difficult. So our economic situation, our occupational situation, our family situation, all of those things make it, in our underlying medical condition situation, make it very difficult for us. But the good news is there are things that we can do, and I don't go anywhere without masks, gloves, hand sanitizers.
Yeah.
It's in my car, it's in my purse, it's in my bag, it's everywhere. And those are things that we can do, and we have to really be careful of our young people. So those that are, you know, that 18 to 40, 45-year-old group, who, that invincible group,
no pool party.
So going to those pool parties, socializing, all of those things. And, you know, yes, we do get tired of Zoom. People are Zoomed out, but it's important that we stay safe. And most important, the people we care about. So we know that younger people may have less severe disease, that they may be asymptomatic, but that does not mean that they can't bring this to their family, their parents, their grandparents, their aunts, their uncles, people that they care about. They don't have any intention of making them sick. But that's the reality is the same thing with flu. Flu is similar. There are asymptomatic carriers. You have no symptoms, but you're hugging and kissing at church and you've passed it on to one of the deacons or someone on the mother's board, or you've passed that on unknowingly. So it's really important that we are using our masks. You know, yes, they get hot. You know, Dr. Hines and I walking around all day in this as you're going from exam room to you get rashes, all kinds of things. But what's the alternative?
Yeah. So
and what are we willing to sacrifice?
That's right.
For our comfort? What are we willing to sacrifice?
Right.
Soap and water to wash our hands and to keep distance. And people are getting creative. You know, they're going to a few people going to large spaces and backyards and socially distancing and having their mask. But now we've got to do the right thing so that hopefully our freedoms will open up in the future. And I think, you know, being in the here and now, we have to realize that by doing these things, we can see some light at the end of the tunnel. But it's going to take all of us to make these changes, to protect each other. So kind of going from a me, I mindset to we. So we've got to try to make that leap to we.
Selfless, not selfish. Ladies, you heard it from the doctor. You heard it from the doctor. Don't go to the pool party. Young people, seriously, you know, I don't have the COVID mentality. You don't know what you have.
Yeah, you don't know. You don't know.
But that makes me think about our pregnant sisters, Dr. Hines. What can we do to help protect them? I mean, is there any concerns around, what are you seeing and what are you telling your patients around COVID-19?
You know, I'm telling my patients, you know, the same things that I tell my family and my friends, and that is from as best a scientific basis that I come from, that the mask has been shown, it appears, to reduce the incidence of you being exposed. And when you add the social distance to it, that at least reduces the likelihood of the transmission of the virus. I talk about particulate transfer. So that means that your hands, just like the cold and the flu, are important because your hands are how you get it to your mouth, to your nose, and right now oral mucosa as well. So if you wash your hands frequently, and so let me say this, there are people who look like they have on the diver suit almost. It's just ridiculous. But if you're touching everything and then you take it off and don't wash your hands, there you go. I've seen people with a mask on and they grab it from the outside and put it down and then go eat something. Why do you need the mask? I'm like, so, but that thought is, and also too, what I see on television, and they talk about lots of our brothers and sisters who are very unhappy. People want to hear what they want to hear. So if you tell them, it's okay, the schools should be all right, you know, as long as you have social distance, it's going to be okay. And yet I strongly believe that the more strict you are, in the sense that you wash your hands, you wipe down the surfaces, you wear your mask, and you do everything you can, and even then it's not guaranteed. But as a pregnant patient, I do tell them that the potential is higher for a more severe result of the illness, more respiratory illness, more potential for sepsis, which I've seen. We've had at least 3 patients with it at West LA. And I have one just last week. She had every risk factor. So it's interesting. She is a diabetic. She does have obesity. She does have chronic hypertension, and she's 38. But then I had another patient. She's only 26 weeks pregnant. The other one I just delivered, who came in at 15 weeks pregnant, septic, could barely breathe. They put her in the unit on the respirator. She got out about a week later. She delivered last month. I happened to catch that baby. They were both COVID negative. Baby was fine. That's just one. It's all anecdotal. I don't know. But what I do know is if we treat it like an infectious illness that potentially has the capacity for increased risk of preterm delivery and other complications, then we'll do better to shield. So far, there has not been enough people, number one, in the studies. And what I mean by that is evidence-based information to show that there is what we call vertical transmission. That means if you have it, mom, that you're going to directly pass it on to the baby. We have not been able to see enough studies and randomized double-blind, which is almost impossible, but at least prospective studies to follow. So no, but you are, whatever mom gets, she will pass on the antibodies, which is good protection to the baby. So the goal is I don't want them to stay in the house and never go outside because their mental health is important. I want them to understand that this is an important infection and to wash their hands and make sure that they don't go places they don't need to. Mm-hmm. And yes, it is exciting to have a new baby, but the baby showers and that gender reveal stuff, no. Do it on the cars up and down the street and do it on the Zoom, but all of that social gathering and excitement and hugging and kissing, stop that. Because I know that that's likely to spread the infection. So I tell them no. They don't want to hear that from me. I say no. They want to go to Vegas because they want to go see family and friends and hang out. I say no.
Yeah.
They want to get on a flight and fly to New York for 5 hours with recirculated air on the plane. I say no. Now, I get that it's important to do what you have to do, but if you are telling me about things because that was what you had to plan this summer for, I say no.
Mm-hmm.
Now, you don't have to do what I say. But my thought is, no, not on a plane, not on a train, not in Vegas. Sound like Dr. Seuss.
Dr. Seuss.
No. It's a short period of time.
Mm-hmm.
Then we can do better. Baby's out, protect baby, protect yourself. But you got two people. I'm always concerned about at least two, sometimes three or more. So please work with me. And the answer is no. You'll
Why
be
do you
able to
think
go
we're
to
not?
Vegas later.
But why do you think we're not getting it? Why do you?
Because you
think
can't see it.
we're not getting it. You
You
know,
can't
especially
see it.
I see young people all the time, and I don't want to just pivot
Yeah.
on millennials and zennials, but
Right.
I see them all the time still gathering. I'm even on my brother about, no, you can't. But then there are seasoned, I call them seasoned saints. They're the seasoned
Right.
folks. My mom told me the other day, she said, I feel like you're the child and I'm the child and you're the parent. I'm like, because you're not listening. Like, stop. No, if you need me to get something for you, I'll get it for you.
Mhm.
Stop just going to the store because that's at that age when you retire, that's the thing to do. You go to the grocery store, so why do you think, Dr. Wilkes-Brandy, why are we not getting it in the Latino and Black community specifically? Why is it that we're just kind of, now I granted, I heard what you said about the essential workers, and I do understand some people have to work, but outside of that, why are we just acting like it's like we're just invincible?
Yeah, I think for that 18 to 40, that younger group, there is a lot of invincibility, and we have to look at what information were they provided initially. When all of this started back in February, March, we were looking at Europe, and the average age of someone infected with COVID was 80. So then the idea, young people can't get it. So again, the message is kind of changing, and then we're trying to open up the schools, and young people are less likely to get it. Then there's like, maybe if you're over 10, you're likely to get it and transmit it. And then maybe a couple months after you have it, there's this inflammatory condition and vasculitis and inflammation of your blood vessels that might be happening to young children. So the messaging has been difficult because initially they were told average age is 80. I don't have anything to worry about. I'm good. I can party.
Yeah.
I can do all those things. So the messaging has been a little difficult. And I think that the other, again, I have to be careful here. My kids get on me all the time about young people. But in terms of kind of in the here and now, this is what I want to do. This is what I do right now compared to, delaying things, that delayed gratification. You got to live for the now. Nothing's promised, and we all know that. But we have to really look to see ahead. Well, if we don't do this, what are the pluses? What are the minuses? What consequences are we going to be dealing with?
Yeah.
Or the idea that if I do get it, I'm not going to get that sick. I'm not likely to end up in a hospital. I'm not likely to be on a ventilator compared to someone 80. And there's some truth to that. They found some techniques for young people by putting them on their stomach and different techniques. They can avoid oftentimes being on a ventilator. So the severity of the illness is not the same as sometimes in other people. Of course, there's the 22-year-old who's got it and died. There's Alabama, I think, COVID parties where you're the winner if you're the first one who gets COVID. And unfortunately, young people have died with that mentality. Some people, is it close to them? I think we're getting to a point now where a lot of people have know of someone who's been affected. Right now, I have 2 colleagues, one, her mother and brother's affected, another one, her 3 cousins are affected. So I think when you realize it starts to hit home, then you say, I guess this is real.
Yeah.
Maybe I do need to make some changes here. So I think until, you see it, you feel it, you experience it, some of us are kind of going on with blinders that we're just going to focus here. We're not going to worry about that. We're just focusing here. But once it infiltrates your day-to-day life, your family, then sometimes that will help us to see differently. help us to be more conscientious.
Yeah.
But I think in general, the risk-taking behavior we know is higher in that group in general. And so it's education. How do we let them know that, yes, we did say that last week, but this is where we are this week, and that things are going to change.
They're changing.
And that we have to change our behaviors based on that.
I appreciate that.
Yeah.
And Dr. Hines, what we're landing the plane here, but what do you want to add onto that? And also, what can you, for the sisters that are watching, and maybe those who are expecting, I know that, the birthing experience has probably changed drastically in the era of COVID-19 in hospitals.
Oh, yeah.
What can they do to prepare themselves?
Yeah. Oh, yeah. I'm a strong proponent for doulas. I think that, having someone with you with the knowledge of the birthing process is helpful. Now, my colleagues and sometimes the nurses, they're like, whatever, I don't want to hear them talking about, because, anytime you say something against or you give a little pushback to physicians, they get upset. Mm-hmm. Well, that's all right. That's an educated patient. That's a good thing, right? So you can take the opportunity to educate them, and you'd be surprised at how much they educate you. But the next thing is the experience is so different because it is a familial experience. It's family, it's a new life, it's new expectations, it's whatever it was that happened in your life. You want to be different, do different. You creating a new life. And then they tell you, no, you can't bring nobody to your visit. And no, you can't bring anybody else except one you designate to the delivery. That's devastating.
Yeah.
But what we are noticing is that there's an increase, or I should say, there's an increase in the numbers or decrease in preterm delivery. It's interesting because people are not showing up as early. We've got a lower induction rate. We've got a lower, this is interesting, lower C-section rate. So I think what's happening is that when people decide they're not coming to the hospital unless they absolutely have to. So I think a lot of stuff we didn't need to do. We're doing some interventions that we didn't have to. And if we just waited a little bit longer, good. Now, there's also the downside that if they don't show up early enough, we run into more severe illness at the time when they do present. So what is my overall thought? I will piggyback on Dr. Wilkes-Grundy. Unfortunately, I think as of this morning, it was about 140,000 people who have died with this virus. And I'm not sure how many millions, 2 million plus, that have tested positive. In a country of over 300 million people, that's less than 1 or 2%. And unfortunately, because we are in healthcare, we on the front line looking at the young person, the older person, the middle-aged, the brown, the black, the white, we see it all. So our view is very skewed, but we know it's real. We know that your zip code can determine to some extent what happens with your longevity in life. Disparities are associated with what access to health care and resources you have. And COVID brings that in flourish out. So unfortunately for Black folks, and we didn't talk about, and brown folks too, the importance of the church. And a lot of people see an absolute juxtaposition with their religious and spiritual beliefs and what science and healthcare is saying.
Yeah.
And what I want to do as best I can is to acknowledge and appreciate the person's spirituality. But if they're sitting in front of me, they must believe in something with regard to science. They must believe in something that we might have to offer that they might not be getting at the church. Because the people who are absolutely invested in what Jesus said or in their religion and spirit, they ain't coming. So they'll deal with whatever it is because they have accepted that. And that is an amazing spirituality.
Wow.
But for those who are willing to mesh it and to say that I believe that my God, whoever that might be, has blessed you, you, and you with knowledge that might help me and mine, I'm willing to listen. So when I hear that, I'm willing to, I'll do whatever I can to help. Because I know I'm not God. I don't have all the answers. And what I learned around a lot of bright people, and I'm one of the assistant clinical professors in obstetrics and gynecology at the new KP School of Medicine, that still does not mean that I know it all. Yeah. And there are people out there with far more knowledge and experience than I have that still don't know it all. But what they do know is that the precautions that we are taking and the investment in your own healthcare and your family is worth making. Just as you invested in your spirituality and your belief in what you believe is going to keep you and help you to get to heaven, you will work with us in helping you perhaps to get there later than sooner. So I am with you, but it's not easy in pregnancy, but they're more influential. I should say more easy to be influenced. They'll do almost anything. They'll quit smoking weed, believing that's medicinal. Lord help me. They'll stop drinking alcohol. They'll try to exercise. They'll stop smoking. And they'll try to listen to Dr. Wilkes-Grundy when she says to get the flu shot if I don't get to them sooner. But that's an opportunity in a short period of time to do so. So I am of the mind that this kind of misinformation out there, I try not to use the word misinformation and just say it's alternative facts. It's alternative information. And then I want to add this. So if you tell me, I've said this a zillion times, you want to drink the apple cider vinegar because you think that's going to help you with your blood pressure and you're only eating whatever it is because that's going to help. Could you take this pill? Work with me for 1 month. Here's a little labetalol. Can you work with me? Keep drinking the apple cider vinegar and here's some labetalol. Keep exercising and running and saying whatever and here's some lovastatin. Keep, you know what I'm saying? If you sit in front of me, add the natural. And that also means stop eating all the fried chicken and, because it's good, girl, and the mac and cheese and all that other stuff and add this to it. And I feel like if you work with your patients like that, no matter what their beliefs are, if they trust, as we say, they trust you, they are willing to do it. And sometimes, what we say, 15%, Dr. Wilkes-Grundy? 15% of the time, that's what I got with you. And 85% of the time, you doing something else. So I got a short window to try to help. But I am still very encouraged that these beautiful Black and brown babies that we are delivering every day they are our future. I'm excited for our future. And I'm just hoping that with improved leadership on all levels in our society, that we are going to get through this. And physicians aren't going to change. We're still selfless, sacrificing people for the benefit of our patients and the calling that we have chosen in this life. So
you hit some really great points. Thank you, Dr. Hines. I appreciate that. And Dr. Wilkes-Grundy, we're landing the plane, and I would love for you just to provide a takeaway that the sisters that are watching here, just something that you've either heard or said throughout the course of this conversation, or something that you feel that is really imperative that you want people to know about where we're living right now. What would you say? What would be your takeaway?
I think, we're in a time where a lot of things are not in our control, but there are those things that are, our situation, where we are, and thank goodness we have these young folks, all colors, a diverse group of people that are out there now realizing what's happening with Black Lives Matter, with a lot of the disparities, with a lot of what we're seeing with the structural racism. So it's nice to have allies who are working at those things together. So we want to be able to see those changes. We have people working toward those changes. We've got to make sure that we're maintaining our own health. We've got to make sure that the things that are available to us, that we're taking advantage of. If there's questions that we have, that we're asking those questions, rather than just saying, oh, forget it, I'm not getting the flu shot. Because we know if we push people too much, they're like, well, why are they pushing me so hard to get this flu shot? What is this? Why do I need to do this? So trying to find that balance. But I think just as we opened, it comes from trust. That we are not here to give you bad information. Our goal is to keep you as healthy as possible and to help you maintain and reach your best health. So the things that are available for preventive measures, and again, a lot of those start with you, getting out, putting those shoes on, doing the walking that you can, do a video on YouTube, on your phone, whatever it is. There's chair videos, people who may have some physical limitations, but focus on what you can do so you can get your flu shot. And maybe it's not for you, maybe it's for your family. Maybe you understand that, yeah, maybe I get this, it won't be so bad, but you know what? If my grandmother gets it, what's going to happen?
Right.
If my mother gets it, what's going to happen? So start thinking about the impact of this on on your family, on the people that you love and care about. So doing things not just to protect you, but to protect your family as well, so that we can, we got to keep the struggle. The marathon continues. The struggle is not over. We've got to be able to keep going. And the healthier we are, the more people that we can kind of get involved, so that we can hopefully change our situation for the next generations. So please, usually about August, the flu vaccines will start coming out. There's lots of different types of flu vaccines that can meet individual needs, egg allergies, or this, no preservative, I'm pregnant. So there's lots of things available. So any questions, ask. And I just want to leave there's a couple of books, because we do have to recognize that there has been injustice to the Black and Brown communities.
Absolutely.
People always talk about Tuskegee, but there's a book called Medical Apartheid, which talks about the long history of experimentation, medical abuse throughout the history of the United States. There's also another one, The Immortal Life of Henrietta Lacks.
Oh, yes.
When we look at vaccinations and cells and science, we've contributed and we didn't even know we contributed.
That's right.
Medical school, I remember HeLa cells. I had no idea. I didn't know that this was from an African-American woman.
Who never got any credit.
Never. So we started a lot of these things, and it's based on the science that we provided that we've come so far. So get your flu shots, take care of yourselves.
Wear your mask.
wear your mask, put it on, wash your hands, and we'll get through it.
Yes,
the Spanish pandemic ended.
Right.
We will get through this as well. But this is all of us. We all got to pitch in. We're relying on each other.
Yeah, appreciate you. Yes. Dr. Hines, your one quick takeaway that you want folks to know or remember.
Healthcare is life care. That taking full advantage of access to seeing your physician, whether it's by phone, by video, or in person, makes your quality of life better, and you become the resource for your family and your friends. And I think that healthcare is life care, because you're going to have a better quality of life when you can get good healthcare. And don't be afraid to switch out and find somebody else if you feel like you're not getting the kind of care that you need. But I hope that something I've said today was helpful. And there's no question that Dr. Wilkes-Grundy, who is my favorite primary care physician, she can take very good care of you. But just know that there are others like us. I'm proud to say that, Madeline, that we are not just the only ones. There are lots of people that work in Kaiser that think like us, that are committed and invested. So it ain't just the Kaiser doctor. All of us do, most of us feel the same way.
Appreciate you so much. My gratitude to you, Dr. Madeline Wilkes-Grundy. My gratitude to you, Dr. Latonya Hines. This has been an incredible conversation, building off of what we heard this morning and just landing the plane here with you both. I'm just so grateful. So thank you. And thank you again for being with us today. And of course, to Kaiser Permanente for their sponsorship of the 20th annual KJLH Women's Health Expo. Be well. Take care of yourself. And thrive.
The KJLH 20th Annual Women's Health Expo at KJLHradio.com. Presented virtually by RastAfri and Radio Free KJLH.